Alright, today we're going to be demoing straight catheters. So what you need your sterile gloves as well as your catheter kit. There are a pack of sterile gloves in this kit. I don't like them as much. They tend to tear a little easier, so I like to use my own. You're also going to need regular gloves, as this is a clean to sterile procedure, and then clean again. So you need to check your MAR, make sure you have an order for a straight cath. Many times when you are straight cathing, it's because your patient either has no sensation, they can't tell when they go, so you're straight cathing every so many hours, or they've had a catheter removed and they haven't voided since the catheter has been removed, and they have so much left in their bladder prior to straight cathing them. So you need to grab all your supplies and then come in, introduce yourself, and perform AID-IT. So, knock knock. Miss Smith, my name is Erin. I'm going to be your student nurse today. Today we're going to be straight cathing you. That is just where we take a small catheter and insert it into your bladder just to drain your urine. It takes about 15 to 20 minutes. It is uncomfortable and you will have to stay still, but we'll do it as quickly as, and painlessly as we can. I'll tell you exactly what we're going to do before we do it, and then we'll go from there. Alright, so I've explained and performed AID-IT up to the T. I'm going to make sure my table is waist tight. It's cleaned off of all supplies other than what I need. I'm going to then do the same with my patient's bed, waist tight. I have a trash can ready to go as well. If your patient has blankets, go ahead and take them all the way to the end of the bed. That way it's one less thing for you to either spill on or for them to get into the way. Your patient does not have to lay flat for this straight cath procedure. It's whatever they're most comfortable in, but laying 30 degrees and less does make it a little easier for you. Always remember to put your bed rail down, but make sure that you have one up unless you have a partner. If you have a patient who is confused or has dementia or anything, it is always best to have a partner. CHI's policy is that when you do straight cathing or Foley catheters, you have to have either a second RN or you have to have a CNA. So you can have a CNA for straight caths. Foleys, you have to have another RN just to make sure that we stay sterile and we can do everything then. Ms. Smith, I am going to lift your gown. So only expose what you have to, and then I'm going to have you put your legs in the lithotomy position, or fold them like a frog. Alright, I'm going to then put on clean gloves, and then I'm going to perform pericare, so washing both sides with just clean soap and water and towels. You can just verbalize this or go as what your instructor tells you. So I performed pericare, she's in the correct position, she's ready to go. I'm going to make sure again that my table is clean. I've got my kits. I'm going to check to make sure that I have the right kit. It's not expired. There's no holes or tears in the package. I have washed my hands. And I like to leave the little bag on the end of the bed just as a trash bag, just so I'm not reaching back over my sterile field. When you open your packages, make sure you've got your watches and your rings and everything off that's going to be in the way. You're going to open first away from you, and then be mindful of where your other outside is, because you don't want it to touch your patient or your patient's bedding. I'm also going to be mindful of this edge so that it doesn't touch my clothing as well. I've got my sterile kit open. I'm going to use the gloves that aren't in my kit, but if I were to use the ones in my kit, I'm going to be very careful to touch only the gloves that are in the kit, and then I would put them on. But since I'm not going to use them, I'm just going to toss them off to the side in case I were to need a second pair. I've already checked to make sure my gloves are the right size, not expired and everything for me. I'm going to make sure I have enough room between my packages so they aren't going to touch. Starting with my non-dominant hand, my dominant hand I'm going to pick up with my non-dominant hand And I'm going to put my glove on. As best as I can. And I'm going to pick up my other with my dominant hand and slide this on. Here's this one was in the package backwards. Alright, and then pinch in the middle and throw away, remembering to be very careful of where your edges are and that you don't drop your hands below your waist. I'm then going to take my drape out of my package. Easy way to remember is blue to the bed. I'm going to fold my package, or my drape, holding my thumbs on the blue side with my index finger and my other fingers on the white side. I'm going to fold it in to protect my hands. This is where a partner would be great so that they can lift your patient's hips if they are unable to lift their own. As this will be your sterile surface between your patient's legs. This is called a fenestrated drape. You may go ahead and use this. You may see in the field people don't use these. It's a lot easier to use a fenestrated drape on males as it just sits over the top. Females, it just kind of gets in the way with lube and betadine. I prefer not to use them, but it is always the best idea to use the maximum amount of drapes possible. So please follow agency protocol. I have my cup, which I will set off to the side. This is still sterile. I have my betadine swabs, my lubricant, and my catheter in my kit. Don't open any of your packages as it will stain our mannequins, so you're just going to pretend to open your packages. I always like to open everything while I have two hands. I'm going to open my lube, and then I'm going to go ahead and stick my catheter inside the lube packet. Then I'm going to take my catheter kit. There's a little notch in the container, makes it easiest, so put that closest to your patient. I'm going to set it on the table, and then I'm going to take one swab. This is where you need to decide which hand is your dominant hand, which one's your non-dominant hand. I am right-handed, so I'm going to use my right hand to control everything, and my left hand is going to be on my patient. Once I put my hand on my patient, I'm not allowed to take it off. So I'm going to put my hand on my patient just to spread labia, so I'm going to go ahead and go down one side, throw away, go down the other, and throw away, and go down the middle, and throw away. Once I'm completely done, I'm going to get rid of my package. So I'm all done, clean. Again, don't take this hand off. Be careful where your arms are and everything. I'm going to then take my catheter out of my lube packet and throw it away. And then I'm going to get ready to insert my catheter. For males, when you insert your catheter, it's going to be 7 to 9 centimeters, and for females, it's 2 to 3. So I'm going to let Ms. Smith know what I'm going to do. Ms. Smith, I'm going to get ready to insert those catheters. When you do your betadine swabs, also let them know what you're doing prior to doing them. They are cold, so they will tense up a little bit. On the count of 3, I'm going to insert the catheter, so just take nice, slow, deep breaths. And if at any time you need to stop, just go ahead and let me know, okay? 1, 2, 3. Alright, go ahead and insert your catheter until you get urine flow. Once I get urine back, I'm going to then take the lid off my cup and fill my specimen cup, put it back, set it back on my table, and I always put the lid on just because I am known to spilling things. So while I can leave this in here, you can use a little notch to hold it in place, but you need to be mindful of where the catheter is in relation to your patient's legs. When I'm completely done emptying the patient's bladder, I'm going to say, Ms. Smith, I'm going to take the catheter out on the count of 3. 1, 2, 3. I'm going to slowly take the catheter out, and as I do so, I'm going to pinch in my hands, but keeping the end of the catheter in the tray to make sure that I drain the catheter completely, and then I can take it out and wrap it up in my gloves and throw it away. Now your patient has betadine and lube all over, so I'm going to head and take my tray and set it back here on my table. Since I no longer need anything to be sterile, it's okay to put something back on my field, and since it is urine, I don't want to go ahead and set it on my patient's just table. I'm going to then, again, provide pericare. If my gloves were soiled and I need from betadine or lube, I would go ahead and wash my hands, change my gloves, and provide pericare with just soap and water again. I'm going to then go ahead and clean up my station. So making sure I throw everything away, clean up my drapes, and throw everything away, as well as making sure I tuck my patient back in, make sure they're comfortable, make sure they don't need anything extra at this time. You shouldn't have to assess for pain, but of course while you're here you might as well, since catheters don't typically need any pre-medication. Always put your bed rails back up and put your bed in the lowest position, and then thank your patient on the way out to make sure you completely it. When you're done with that, measure your urine, go ahead and flush that, and then send your specimen up to the lab.